IVM.
Hello and welcome to the Habit Coach podcast. I'm Ashdin, doctor, your habit coach. And today we're going to be talking about fertility. We're going to deep dive into fertility because this is one of the most interesting changes that is taking place, especially in our generation and going forward, where fertility rates are dropping dramatically. And I've always wondered about this when I know that fertility is so closely linked to our health and the kind of health status that we are carrying with us every single day. So, with us, we have a very special guest. We've known each other through the pandemic and the lockdown because we did lots of Insta lives together. We were introduced by a friend and an absolutely amazing person. Dr. Yuvi, welcome to the Habit Coach podcast.
Thank you, Ashdin. Finally.
Finally, we've been saying finally, let's do
for a
podcast
long
for a
time.
year now. Dr. Yuvi, tell us a bit about yourself.
So I known by Dr. UV through, of course, social media. My name is Dr. Yuvraj Jadeja. Basically a gynecologist. I specialize in fertility, surrogacy, and now a little bit in queer health and fertility. I have my own center. I practice out of Gujarat. And of course, a little bit in Mumbai doing those consultations and all. And I head a fertility unit in a medical college in Gujarat.
In Gujarat.
Yeah.
Lovely.
That's briefly what Dr. Yuvraj is.
Yuvi, when you started your career with fertility, and now, what do you see as a difference? Has there been a dramatic change?
Extremely. And my career, mind you, has not been that long. I've not been for 50 years, 25 years, like a lot of senior doctors
Correct.
have. I think I started my gynac in 2012. And there is drastic change in fertility that we've seen. I mean, initially IVF was easy, to put it in very simple terms. Treating infertility was still easy. Okay, you do an IVF and you used to get your eggs, the sperms were good. And now it's getting difficult day by day. The fertility rates are going down. The quality of your gametes, which is your ovum, your sperms, is going down. And the worst part is half of the time you're not able to diagnose it. The diseases are increasing, but our tools to diagnose it and actually address it are still the same. We've not made that leaps and bounds yet there. So in this 10 years, I've seen how fertility rates, the age of optimal fertility, when I used to study, people used to, we've all heard that, like for example, a woman used to be told that, you finish your fertility career before 35. I think now we've all come to 30, 32.
Correct.
Initially, we thought men and sperms have no relation with age. Now we know for the fact that, men with age do have decline in their fertility rates, quality of their sperms.
Oh, so it doesn't go up till 90 like
So you can always conceive, but your chances are decreasing.
All right.
So maybe that we have better tools to diagnose them, but most of us in fertility world feel that it's not just the tools, it's just that our health per se is decreasing.
And this is just 10 years.
It's just 10 years. And there's something, there's a terminology known as spermageddon.
So,
So I think a lot of you might have read these articles where, it said that decade by decade, the Y chromosome is losing its strength. So there's actually a speculation that there might be a time that males might be extinct from the world, or so-called XYs might be extinct from the world.
Wow, really? So what is happening? Why is this taking place?
Honestly, we don't know.
Okay.
But of course, you can always have this parallels that you can draw. And I think the easiest thing or the most evident thing that we see is what we all talk about today, which is lifestyle, which is the environment, the pollution. When recently we used to read about these, when these articles about finding microplastics in humans and
Correct.
all. We've known that. So plastics, packaged foods, sugars, pollutants, your air quality, your water quality, everything, So what we technically call as endocrine disruptors. And your fertility is basically the endocrinological part of your body. So these endocrine disruptors are causing this disruption in your hormonal balance milieu of your body. And probably that is one thing that's really affecting human health. Of course, stress, smoking, drinking, drugs, all that included.
And what I find fascinating is that, just like you said, it is the standard life that is already so bad. And then on top of that, we add insults to it, right?
Yeah.
Like you said, like the drinking, the smoking,
Yeah.
etc.
Yeah.
are on top of it that we are choosing to do to ourselves.
Yeah. And interestingly, in the practice itself, if you see, when you try to address the issues, most of the patients, want treatment above that.
Mm.
We
I don't
also
want to stop that lifestyle.
exactly, and sometimes you take offense. Like, how can you ask me to stop drinking? Why are you asking me to reduce my weight? I mean, a doctor is not going to gain anything, but the whole point is to not just increase your fertility but an overall health, because also when you talk about fertility, we forget that it doesn't end by you getting pregnant. Then there is 9 months of a
Correct.
very complicated period that you're going to travel.
Yeah.
And that will also your health will determine your good pregnancy
Correct.
period. Are you going to enjoy it, or are you going to stay in bed and drink and eat a lot of medicines?
Also, the quality of your child and the quality of you afterwards.
Exactly.
Right.
And that's known. I think that's a very good point you brought about. Now we know that how a child's health is, what link does it have to that antenatal period, which we call, which is the 9 months of the mother's health.
Correct.
How she was during that period. So the genetic factor, the epigenetic factors are all working throughout.
In fact, one of the things that gets my goat every single time is when people say, now I'm pregnant, I can eat everything. Abey, Dhakka, no, you're supposed to be even more particular now that you're pregnant
Exactly.
than before, because now you're actually eating for something that's making something, right?
Yeah.
And the cells in the baby are the freshest that they're ever going to be.
But that's also like, there are two ends to it.
Okay.
So one is, as you said, now I'm pregnant, I can eat anything. And then there's another end where people just don't allow them to eat. Ye nahi khana chahiye, ye nahi khana chahiye, wo nahi khana chahiye.
Very strict.
So exactly. And so you just have to find a balance. I think that's what doctors are for, right?
I think so, and guiding you through that process is so important.
Yeah.
Which is more difficult if you're going to talk about male fertility and female fertility, which one is more difficult? Which one more complex? Let's start with that one.
Female. Solely because of the reason is, so like we've all heard, males' sperms are in millions.
Correct.
Even the worst case scenario, something that we call as oligospermia, which means decrease in your sperm count. You might have ideally it's somewhere around 30 million or 15 million per ml. Now, even if you have 1 million, you can still conceive through processes of infertility, IVF, ICSI, whatever.
Correct.
But a female decrease in quality and quantity of female egg, it's very limited. There's an age again there. So it's said that a female is born with a certain number of eggs, which keep on declining. And, once they are over, that's when you hit your menopause. So that you can't reverse.
Correct.
And again, every cycle or every time you try to treat it, there is only a particular number of eggs that she's going to release or she's going to give. So that makes treating female infertility a little more difficult. You need to push them. That is why the whole concept of egg freezing at younger age and all this comes into picture, because then someone comes at 45 and says, I want to get pregnant. It's going to be a damn tough job. But if a 45-year-old male comes and says, I want to be pregnant, it's still doable.
Interesting. But is there truth to that there are only a certain set number of eggs, or is science changing on that?
So there is a thought that it's not like that. They can be pushed, like stem cell treatments and regenerative medicine is coming in big way.
Okay.
But we are far from being confident of saying that, I can treat you. I will reverse your menopause. We have, and that's the biggest problem, why when we say fertility rates are decreasing, younger people are getting infertile faster. And at the same time, our marriage age has increased.
Correct.
Before we used to get married at 25. Now people are getting married between 35 to 40. Career has come into picture. Even if you get married, your childbearing age has started to increase. You don't want to have child earlier. You want to finish or achieve a certain goal in your life. Fair enough. But we still are not able to reverse that age.
Correct.
There's no medicine. Like if a patient comes and tells me, so there's something known as AMH, which is an anti-Mullerian hormone, which is an indirect indication of the quantity of eggs and probably quality of eggs that are there in your body. If your AMH has decreased, if someone comes and tells me, doc, give me some medicine to increase my AMH, my answer is we can try, but it's probably not going to happen.
Oh, no matter what lifestyle changes, no matter what medicine.
So you might decrease the decline.
Okay.
Exactly. You might try to kind of nurture and preserve what is left, improve the quality a little bit, but you're not going to again. So chronologically, you might be 35, but your biological ovarian age might have become 45. We'll never be able to reverse that.
Interesting. So, Yuvi, I normally see these as two separate stages. There's one entire stage in life where you go through saying, I don't want to get pregnant, I don't want to get pregnant, I don't want to get pregnant. And then one change happens, now I want to get pregnant, I want to get pregnant, I want to get
Yeah.
pregnant. So, what do you do? Like, we can discuss three habits in each of these categories.
Yeah.
What are three things you can do during the I don't want to get pregnant stage so that when you do get
Yeah.
pregnant, you're fully gung ho and ready to?
Yeah. So that's a very, very important question. And I think everyone, should really keep these points in mind. I think the first is, as we discussed, you need, irrespective of whatever age, whatever health you are, you need to maintain your lifestyle, a healthy lifestyle. That's key to everything. Be it your hair, your egg, your eye, your stomach, your gut, whatever, or your ovary or your sperm. So one is a healthy lifestyle. And when I say healthy lifestyle, who better than you? I'm not asking you to be like like an athlete. It just means take care of what you eat, work out a little bit, your sleep, your stress, just maintain it a little bit.
Just add a few little tiny healthy habits to what you're doing currently.
Yeah.
Okay.
As you say in your podcast.
Yeah,
right?
just little tiny
bit.
tiny
Chota.
bit.
Yeah. So one is that,
Okay.
if you're maintaining a healthy lifestyle and all. Second, I think is it's always, so we've in India, it's this concept that, you're 35, you're 40, now you start your yearly checkups. Well, there's no logic to that. You can start your yearly checkups at 25, probably twice, maybe once in every 2 years. But you can, if you're planning to delay your pregnancy or your fertility, just go to a gynac, have a consultation, what we normally call as preconceptional counseling. Also, even before you try to get pregnant, am I all right? Do I have the time? And most of the time,
am I all right? Do I have the time? That's an important question to ask. Right.
So when I say, am I all right, means you might have an underlying diabetes, you might have an underlying thyroid, which you might have never known. And then you get pregnant and then you see an area of complications. You want to avoid that. And when you say, do I have the time, means, is your ovarian reserve normal? Is your uterus normal? Are you not suffering from any collateral diseases? So your gynac will tell you, okay, everything is all right. Probably take your time. It's okay. Not that it's a guarantee, but that's the best you can do at that point. And I think the third very important thing is, what if the gynac tells you no? Like, I don't think you have the time. And I think we are all for careers in terms of, be it a male, be it a female, anyone, it's important. You don't need to hold your life just for your fertility career. I agree. I'm one of those. Correct. There are a lot of fertility specialists who say, nahi, 30 pe bacha kar lo. To each its own. But if you don't want to, then there are alternatives. Explore egg freezing, explore embryo freezing, explore sperm freezing. So that at 35 or at 38 or even at 40, when you decide to get pregnant, try for a couple of months. If not, you have a backup. Your success rates are going to double.
Right.
So these are the three things I think everyone should keep in mind.
Wanting to get pregnant, when you're passing through the phase of I don't want to get pregnant, you need to at least plan for the time that you might want to at some stage.
Exactly.
Lovely.
In fact, a lot of multinationals like Apple, Google, they are now using this as incentives. They give free egg freezing to their female employees.
Oh, wow.
As a part of the packages.
So you can be part of your career and have this.
Exactly.
Very interesting, huh? So I'm going to put you on the spot. Like, your first habit was get your, gender lifestyle in place.
Yeah.
What have you noticed that gives you the best bang for your buck? So is it sleep? Is it nutrition? Is it exercise? What actually moves that needle fastest in some patients?
I think it's exercise and food habits combined. Like, I've seen people who really work out and have good food habits. People don't like me when I say that, stop sugar and all that.
Yeah. But on this podcast, you can say stop sugar 35,000 times and everyone who's listening will be like, yes, sugar is horrible. It's been like implanted in their brain. Huh?
Yeah. So I think even in whatever practice I have, I've really seen drastic changes. I've seen periods become irregular from irregular. I've seen and when you say, the biggest misconception here is when you talk about health and when you talk about exercise and food, and mostly in connection to weight loss. When you say lose weight, we don't mean you lose 15 kgs in 1 month and come. When you mean lose weight, means you can lose 2 kgs in a PCO and you might see drastic changes. In fact, we see people conceiving just by probably stopping sugar for 2 months and losing 3 to 4 kgs of weight.
Correct.
So I think food and a little bit of exercise.
This reminds me of when I first started my habit coaching business. I had 2 clients that after 4 months got pregnant.
Yeah.
And they hadn't meaning it wasn't part of our
Yeah.
discussion or anything like that. Obviously, I lost them as clients because now they were pregnant, so they couldn't continue doing what they were doing. But it was so interesting. They were like, my God, we've been trying for so long.
Yeah.
And suddenly, just because these little changes that take place
Yeah.
lifestyle-wise.
And this is scientifically backed.
Yeah.
It's not experience. It's not just the nutritionists who are saying it. Like, we've got animal models which have proved. We've got, like, I don't want to go into the details, but we've got models where rats have been asked to run for a couple of hours and a few rats have been asked to eat all the fatty food and grown fat and then seen their fertility potential. And it's proved
Correct.
that the quality of eggs in those animals was better. The fertility rates were better. The litter rates. So litter rate is the number of
babies they can have,
choto babies that they have. That was better. So it's all proved. It's not that ऐसे ही सब बोल रहे हैं कि खाना बंद कर दो. Like, no one is going to gain anything by asking you to stop sugar and not eat
In
and
fact,
exercise.
that's the thing that I'm guessing most of you as doctors will be having a problem in this day and age, right? The first thing I will tell you is lifestyle.
Yeah.
And then like all doctors tell me the same thing. Mujhe dawai do.
Yeah.
And that's going to be a big
And you know,
one.
there was this trend recently on social media where people started thrashing doctors, like they are body shaming. And I feel when you come to a doctor, like, I think 80% or 85% of doctors are not going to shame you in any way.
Yeah.
They're just laying it out what they say. Probably sometimes you might need to take care of the language that they're using, but that's a communication problem. That's not a mentality problem. I think people should understand that. Like, if they tell you to lose weight, it's not because they think you're fat. It's because they want you to get healthy and pregnant for a fertility specialist.
Correct, absolutely.
If a cardiologist is asking you to lose weight, it's not because he wants you to look. He thinks that thin is beautiful. He wants your arteries to be not clogged and your cholesterols to be normal.
No, absolutely. And a few months, I think a year ago, I was asked this question about body positivity.
Yeah.
Right? And I was saying body positivity is great for the things you cannot change.
Yeah.
Right? Like my nose, I cannot change.
Yeah.
But if I have the ability to change my health and improve my health, then there is no place for body shaming. It is actually an advice that is given for a better lifestyle. I think that is the way to start thinking about this body positivity.
We're going to take a quick break. See you on the other side.
Hello, everybody. Welcome to another great week on the IVM Podcast Network. This World Yoga Day, Ashdin is joined by global yoga icon and lifestyle influencer Sunena Rekhi. They talk about how one can take care of themselves using yoga. Catch this only on The Habit Coach. On the Filter Coffee Podcast, Karthik speaks to author Vineet Karnik on the business of sports. On Smarter with Sid, Siddharth explains how the human library in Denmark works. On Marathi Kirkitun, the Deshmukhs share unique incidents they came across while reading. And on Ek Jiski Finance, Priyanka teaches us how to write a will. Just a reminder to everybody, the IVM merchandise is now available. You can go to the IVM Podcast website and click on the shop tab. Check out our first collection of t-shirts. Also, do follow us on social media. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. And I'd like to remind you all that it is really, really helpful for us when you do recommend this show or any of our other shows to a friend. Word of mouth is great for us, and it's really a great way for us to grow our audience and have more people for you to discuss your podcast consumptions with. Also, don't forget to rate us on any platform you're listening on, and you can also check us out on YouTube at ivmpodcast.com/YouTube. We have a list of the YouTube channels we are on. And finally, we'd like to thank our sponsors this week, Capgemini, Intel vPro, and Intel Future But Now Wonderful. Thank you so much for making this possible.
Welcome back. All right, let's jump into the conversation.
Okay, so the next stage. Now I've hit the stage when I want to start conceiving. What are the things that I need to do that are different from earlier?
So, the first thing is you need to understand, when do you call yourself infertile?
Okay.
Like, ideally, if you're less than 35 and you've tried for a year, you've tried regular unprotected sex for a year, you've understood what your ovulation dates are and what is the fertile period, and you've tried for a year and you're not able to conceive, it's time you need to go for a checkup. When you say, and a fertility specialist, and that does not mean that you're going to do an IVF. It just means you need to go and ask your doctor, is everything all right? Do I still have 6 months to try naturally? Or do we need to do something else? Then, if you're more than 35, that 1 year becomes 6 months. You try for 6 months. If not, go a little early because the time is not in your hand. It makes that
much of a difference, huh?
It makes that much of a difference. So once you establish that, okay, everything is fine or there is a problem, and whether you are infertile or not, then of course, basics of how do you try? What is the frequency of natural intercourse that you need to have? when is the time? So sometimes, it's very simple things. People just don't know which is the fertile period.
Correct.
They might be trying in wrong times, their schedules are not matching. And then the doctor realizes, okay, if you're not going to try from, say, probably 12th to 18th day of your regular cycle, you're not going to get pregnant. Your chances of getting pregnant on trying on the 28th day of your cycle or on the 6th day of your cycle is hardly 5%.
Correct.
So then you kind of align your trial methods and basic reports, like you're not suffering from things that are making you anovulatory, you're not a PCO patient, you don't have a thyroid, you don't have diabetes. Rule that all out. 1 month, 6 months, whatever you've tried, then it's not happening. Then of course the doctor takes you a next step forward, which is simple medications, which we call as ovulation induction medications. What it helps is, again, it kind of pushes your body to make eggs, and we do something known as timed intercourse. So then the doctor takes the ovulation in his or her hands and tells you, look, these are the dates. Your egg is going to rupture in the next 36 hours. Try. That's tried for a few months. Then the next progression is probably an IUI, which is known as an intrauterine insemination. And if that doesn't work, then you move forward for IVF. And then there are a lot of other things. You might need a donor egg, you might need a donor sperm, you might need surrogacy. But then early on, you are a candidate for which road, actually.
Correct. And then you can plan your life accordingly, right? Because many times these are expensive procedures as well, right? So you'll have to figure
It's expensive. It takes a toll on you. It's stressful.
It's stressful.
And there's a lot of societal pressure involved. You might say that you don't care, but, ultimately once you start trying, everyone's going to ask you what has happened. Every month you get your period.
That itself is stressful.
It's very stressful. So, whether you're wasting your time, you're doing the right thing or not, it's better to have that guidance.
And like you rightly said, there are so many steps before you reach an IVF or before you think about surrogacy. And many people jump to that as the final conclusion, saying that if I go to a doctor, that's what he's going to tell me to do.
Exactly. And that's the biggest myth. Like ideally, when you go to a fertility consultant, until and unless your reports are really down the drain and it's something that you don't have a time and you need to step. Like for example, if someone has blocked tubes. So if your fallopian tubes are blocked, you are never going to naturally conceive.
Correct.
Until and unless you either unblock them or you do an IVF. Because your egg and sperm is never going to meet. You can try for hundreds of years. That's not going to happen.
Yeah.
So that's what the doctors does. Otherwise, normally, before jumping to an IVF, any fertility specialist will at least take 6 months.
6 months minimum.
Yeah.
Lovely. Okay. Men. What are the, like we just broke it down to these two categories. What are the stuff that when I don't want to get pregnant, what are the things that they need to do? What are the things they need to do when they want to start getting pregnant?
With men, sometimes unfair, but it's a little easier. But still, nowadays, again, as I said, spermageddon is coming.
It's increasing so dramatically.
So, we've seen that. Male infertility, the rates of male infertility are definitely increasing. And again, with male infertility, first, of course, is your lifestyle, like alcohol, smoking, tobacco. It really affects the sperm quality. And, we say this thing that, eggs and sperms, and rightly so, are the most delicate cells of your body. Like even if you have a viral fever, your sperm quality is going to decrease for the next few months.
Correct.
So imagine when you insult your body with a lot of drinking, a lot of smoking. And when we say drinking and smoking, we don't mean like once doing it in a party. No one is asking you not to do that. What we mean is on a regular basis. And I think we all know when we go overboard.
Yeah.
That's one thing that really affects sperm quality. Second, these days, temperature. So people who work, who travel a lot, who work in places which have high temperature, furnaces, they need to really take care of. Third, of course, is,
But temperature is I'm coming back to this one because it's something that we hear, like since school, we're saying that testicles drop, so it's supposed to cool down, etc., etc. But in today's day and age, there are so many things that are not working in our favor, right?
Yeah.
So, for example, laptops, we put them on our lap, our phones are in our pockets, all those things, do those affect? How do they affect? How should we start?
It does. So that was going to be my next point. So then temperature and laptops, mobiles, etc. This is all like radiation plus temperature.
Correct.
So it's a double insult. But I'm sure we can help it, you can just buy a stool. You don't need to put your laptop on your testicles, right? We can do these little things.
Where do you carry your phone?
I have it in my pocket.
See, that's the problem, right? We don't have another place for this.
So, one of my teachers used to say that. So there's an interesting joke in The Doctor. So then another option is you put it in your shirt pocket.
and
So
a
then
heart
there's a
attack.
heart.
Correct.
So one of my andrology teacher used to say that now you choose whether you want to protect your sperms or you want to protect your heart.
You can't have both. Yeah, because a friend of mine the other day saying, you're still carrying your phone in your pocket. You're going to fry all your little Ashdin.
So phone is, well, you can avoid.
Yeah.
I mean, I have to say you have to avoid. But laptop is like, it's temperature. It's like directly there, These are small things that you can do. It's not that just by not carrying your phone or just by carrying your phone in your pocket, you're going to become infertile.
Right.
But it's like when you, as you said, there are a lot of things you cannot help. Like today, like where I stay, Baroda, the temperatures were reaching 44 degrees. You can't help that. But
don't wear pants, huh?
So that's one of the other things, there's a lot of times you're asked to, not wear too tight. Your inners are not to be too tight. Or, when you sleep at night, like let it breathe.
Correct.
So all these things you can do, right? Not do a lot of sauna.
Not do a lot of sauna. Right.
Another big thing is these whole surge of using steroids and, muscle building and all in gyms. It is so much more common. I mean, I never thought that I would have to learn these things, because now even I know what these people need to do because it's become, I won't say abuse, but an unauthorized use of these steroids for muscle building has become so common. I mean, in small towns of Gujarat, guys are taking it left and right. And they have these protocols being provided. उनको पता है testosterone propionate क्या है, उनको पता है clenbuterol क्या है, stanozol क्या है, what they need to do to reverse its effect, what they need to do to reduce the hair fall, what they need to do to reduce the breast growing and all. So, but that again, taking testosterone causes all these problems in terms of your fertility again.
And natural testosterone, do you see a decline in that taking place amongst men as well?
So, testing of testosterone is a little bit overrated.
Okay.
It's more of when you show the symptoms.
Okay.
Your testosterone might be low, but if you're not having any symptoms of low testosterone, it's working for you.
Okay.
Your testosterone might be a little not under the range of its normal range, but at the same time, you're still having problems of, say, ejaculatory problems, sexual problems. Then it's, so to each its own. Everyone has their own individual testosterone levels. But more of it, so indirect answer would be since sexual health in men is anyways decreasing. So the effect of testosterone somewhere is having these effects.
Right.
But technically speaking, the level of testosterone, as I said, is, very overrated. People just do their testosterone level. And I'm so glad you brought this up because practically what happens is when someone is having a premature ejaculation, if someone is having an erectile dysfunction, what they do is they just go to a lab, get their testosterone tested because they've read an article. And they see that the testosterones are low and they start supplementing themselves with testosterones. And then they forget that one, it was not needed. Probably it's another cause. Second, if they are trying for pregnancy, taking external testosterone is going to reduce your fertility.
Oh, so then you're just making it even worse.
You're making it worse. And then they feel that I'm taking testosterone, but I'm pregnant nahi ho raha hu. Because it's supposed to be the male hormone, right? So one is, of course, your lifestyle. Second is, again, when I say lifestyle, take your vitamins, take care of your health, your diet and everything. Again, get yourself checked. The biggest problem in India today is that males feel they are invincible when it comes to fertility. And the biggest myth that they carry around is just because they produce it's like shitloads of semen, they are fertile. But you need to understand that the quantity of your semen load doesn't mean that you are fertile. You can have 100 ml of semen you're producing, it could have 0 sperms.
Right.
And that's the biggest. So men feel that just because they're ejaculating, everything is normal. That's not the case. Every infertile, fertile, or trying to conceive men who are having some kind of difficulty, I think before getting their wives checked, should at least get a semen sample done. I mean, what does it take to give a semen sample for a guy? You know, females ke liye to bichare ke liye transvaginal scan, blood test, a lot of things, a lot of invasive things also happening for a man, but still we are so resistant.
So should a man go to a doc before he wants to conceive or not necessary?
So ideally, it's a preconceptional couple counseling.
Correct. In fact, that's going to be the last section is about how do we as a couple go and do this.
Yeah.
So for a man, for example, I'm passing through this phase where I don't want children right now.
Yeah.
Should I be going to a doctor, getting things checked, or should I not be?
So it's not just about semen, right? Everyone should go to a doctor once in a year, I feel, and go to a doctor. The biggest, other big problem I have is abhi, ये packages आ गए हैं, silver packages and gold packages, path labs आपको दे देती है, वो घर पे आके blood ले जाती है, वो आपके पता नहीं XYZ tests करके आपको घर पे भेज देती है. One, do you even need those tests? Second, do you know how to read those tests? And third, what do you do with them? So yearly, if you go to a general physician also, it's not just about getting your semen tested. It's about getting your vitamin B12 tested these days. It's about getting your vitamin D tested these days. Again, when you talk about health, you're seeing so much of B12 deficiency, vitamin D deficiency. All this indirectly is also going to cause a problem with your semen.
Correct.
It's also about getting a STI panel if you're sexually active. That's so important today. So I would say it would be good if you could, but that's far off a dream in our country. But at least get your blood panels done and see if you're healthy or not. But if you have an underlying condition, say for example, if you're going to be on long-term steroids, if you're one of those muscle-building person, or you're going to be a model and you're going to take those steroids or something, or you're going to be on some immunosuppressive drugs, if you have a severe illness in your body, if you've had a surgery that's relating to your genital areas, then it's always better. So a lot of patients, chemotherapy patients, radiotherapy patient, cancer patient, guys who are going to take radiation and chemotherapy, they're usually advised to go to a fertility clinic, preserve their semen sample, and then take their treatment.
Makes sense. Lovely. I want to get pregnant. Now what do I do as a guy?
So I will take it together because if you want to get pregnant and if you're a couple, then the first thing is you need to approach a fertility clinic or even a gynecologist in this case to do your preconceptional counseling. One is because you need to understand what are the rules, so to speak. कैसे आप optimally try कर सकते हो. Second is everything all right with you? If you have an underlying disease, just treat them before. Also, you need to be put on these nutrients, folic acids, multivitamins, so that the chances that your babies have nutritional deficiencies, deformities is going to decrease. And like, for example, in India, thalassemia rates are very high. Most of us have never done thalassemia tests. Now, for example, if both the couples are thal minors, there's such a high chance that you're going to produce a baby that is going to be thal positive or thal major. So you need to test these basic tests. Your hemoglobin levels are normal before trying for. So that's your first visit. You decided today I want to get pregnant. Go get yourself checked. Everything is fine. Don't see the doctor for a year if you're less than 35. If you're more than 35, for 6 months. And then probably you can see that, okay, we've tried for a year now. It's not working. Let's do more tests or the next step.
Interesting. And the question is also, how do you, I'm sure a large part of what you do is also counseling both of them, right? Have you noticed, are there certain things in the communication that they need to do with each other? I've noticed that a lot of blaming starts taking place.
Yeah.
Like, how do you get over all of those things? Because that is a natural part of being human also, right?
Yeah. So that's another huge problem, I think, especially in our country. And it's sad to say, but again, the entire patriarchy, our social structure, is a little unfair on the female counterpart. So usually the counseling, now what fertility consultants try is that, we need to make them understand that, do haath se taali baj rahi hai.
Correct.
It's as simple as that. You can't bring your wife and get her tested and say that, I am fine. So we always make sure that both of you are getting tested. Bahut baar to the in-laws just bring the wife. Husband doesn't come also. They just feel that nothing is wrong, just get her tested. And now doctors have kind of taken that stand and stopped doing that, like, no, get your husband. Then you kind of counsel them. You need to tell them that, again, the whole, I think, a little out of the context, but again, the whole idea in our country of ladka aa raha hai, ladki aa rahi hai and all that, like every person who's done science till 8th standard knows that it's the sperm that carries either the X or the Y chromosome. It's the guy, so to speak, who is going to decide the sex of the baby.
Correct.
But again, the whole onus falls on the female. And medicine is also a little bit unfair. दवाई भी उनको ज़्यादा जाती है, इंजेक्शंस भी उनको ज़्यादा जाते हैं, प्रोसीजर्स भी लाइक IVF करो तो a female has to undergo like 10 to 12 days of injections, the entire procedure to retrieve an egg and then implant the embryo. What the guy has to do is just probably jerk off and give a sample.
Correct. Absolutely. There's nothing that, and it is very one-sided that way,
Yeah.
right? Yeah. And I was in fact talking to a friend of mine the other day, and they were saying, oh, she is perfect. He is the problem.
Yeah.
And it always turns into that, this
Yeah.
one's the problem, this one's perfect kind of a thing. And you need to realize you're a couple in this.
And also it would be a little unfair now here to not point out that majority of the time it's this, but at the same time, the counseling also involves around sitting and talking to the men because the financial burden really falls on them.
Yes.
They are not supposed to feel dejected, feel sad if things are not working out.
If it's a donor's sperm, it will be even more mentally
So the
affected.
stress levels sometimes are also quite high in the men. And sometimes us as doctors are guilty of kind of neglecting. So we kind of concentrate a little bit more on the female side because we know everything is happening more there.
And like you said, it's more complicated.
It's more complicated there. But at the same time, we have to sit with the husband and counsel him because it's going to be sometime a costly affair.
Right.
And it's the burden that he's going to take. It's going to be a journey that's going to require a lot of mental support, family support, friend support. The couple, kind of understanding themselves and, there are going to be stressful nights, there are going to be stressful days when she might be irritated, he might be irritated, and how to kind of sail through that difficult period.
That's the toughest, right? Because it is so hard on the system going through the procedures that it does play an effect. Lovely. Yuvi, anything that we've missed out that you want to put across to our listeners saying that, when it comes to fertility, just like focus on this one thing, one habit, one thought that makes sense?
I think I've seen one thing. However bad your fertility is, however bad your reports are, you don't know when it's going to happen and how it's going to happen. But we've seen if you are at it, it happens. I've seen people do 13, 14 IVFs.
Wow.
And succeed in the 15th one. And I've seen the worst of patients succeed in the first cycle itself. So you need to embrace yourself that this is going to be a journey. It's not about the result will come, but you can't quantify your journey. You can't say कि मुझे 2 महीने में result चाहिए. कभी वो 2 दिन में भी आ जाएगा, कभी वो 2 साल भी लग सकते हैं. So that's one thing that people need to really understand. Second is, of course...
So it's not hopelessness, but it's have faith.
It's have faith.
I think that's the...
And keep on it.
Keep on it.
Have faith in terms of the general faith. Have faith in your doctors. Have faith in yourself. And you will require sometimes to work a little bit harder.
Yeah.
Mentally, financially, physically. All 3 ways. But the results usually come.
Fantastic. Dr. Yuvi, I absolutely love this podcast. Thank you so much for coming on The Habit Coach. How can people continue this conversation with you? Where can people get in touch with you?
You can get in touch with me on Instagram. Dr. Yuvi is my handle.
Dr. Yuvi on Instagram. Perfect. Thank you so much.
Thank you. Thank you, Ashdin.
Now, if you like this podcast, don't forget to check out other interesting podcasts on the IVM network. You can listen to us on the IVM Podcast app or ivmpodcast.com. You can also follow us on social media. We are at IVM Podcast on Twitter and Instagram. If you want to reach out to me, I am at Ashdin Doc on Twitter and Instagram. We have a brand new habit coaching online course, quizzes, videos, and a lot more on the website awesome180.com. So check it out now.
There's a quick survey to fill out on ivmpodcast.com/survey. It lets us know a little bit more about who's listening to us. And you know what? We're going to do a few prizes. So, we'll do a random drawing of maybe 10 people and we'll send you all some swag. Remember, that's ivmpodcast.com/survey where you can fill out the survey.
Inflation, fiscal deficit, GDP, MSP, NPA, equity market वगैरह वगैरह. दोस्तों, हमने सारे शब्द टीवी या अखबार में जरूर देखे होंगे या फिर सुने होंगे, पर हम में से कितने लोग हैं जो ये जानते हैं कि इन सब का सीधा प्रभाव पड़ता है हमारी सैलरी पर, हमारे इंक्रीमेंट पर और कमबख्त हमारे खर्चों पर. दोस्तों, मेरा नाम है अभिनव त्रिवेदी और मैं बात कर रहा हूँ इक्का दुक्का इकोनॉमी पॉडकास्ट से, जहाँ पे इस तरह के इकोनॉमिक और फाइनेंशियल टर्म्स को मैं जोड़ूंगा सीधा आपकी जेब से. हर मंगलवार एक नया एपिसोड सुने IVM पॉडकास्ट की वेबसाइट, ऐप या फिर किसी भी अन्य पॉडकास्ट प्लेटफॉर्म पर.